If you're experiencing pelvic or genital swelling from lymphedema, this video is for you. I'm going to go through the best treatments for decreasing that swelling and discomfort that you're experiencing with genital swelling. This is the first of a 3-part series on genital lymphedema and how you can successfully treat it. I'm Dr. Alex Hill. I'm a board-certified physical therapist and lymphedema therapist. I specialize in pelvic health and oncology. Make sure you subscribe to my channel, turn on those notifications for more videos on how to best manage your pelvic health and your lymphedema symptoms. Genital lymphedema can develop because of pelvic cancer and cancer treatments, especially when lymph nodes are removed during a surgery or if you have radiation therapy in the pelvic region. Swelling in the genitals can also develop if you have swelling in your legs that involves the thighs, if there's any trauma or injury to the lymphatic system, if there's a skin or tissue infection, and the swelling can even be related to if you have heart, kidney, or liver issues. If you have swelling in the genitals, it's critical that you get a comprehensive medical workup to rule out anything else that might be going on besides just lymphedema. Once it's determined that the swelling is lymphedema or lymphedema related, then you want to get started with treatment with a certified lymphedema therapist or a CLT. A lymphedema therapist can perform a thorough assessment of not just that swollen area, but also how you walk, stand, and move, your hip strength and mobility, and get you started on a comprehensive treatment program to reduce the swelling and help you reach your goals and move better. Since lymphedema is a chronic, lifelong condition, managing it is very important. If lymphedema is not managed correctly, that swelling can get worse and even progress to more advanced stages and lead to more complications like pain, fibrosis, and infections. The gold standard for treating genital lymphedema is called complete decongestive therapy, or CDT. You might also hear it called complex decongestive therapy. It's been extensively researched for decades, and it's been proven to be both safe and effective when used appropriately and with a lymphedema therapist for treating any stage of lymphedema. That means that it's never too late to get treatment, but you will have better outcomes if you're able to catch the lymphedema earlier and get started with lymphedema treatment sooner. CDT can be an intensive process, especially for those with more advanced lymphedema, like stage 2 or 3, and it has 4 components, and these are manual lymphatic drainage, compression, exercise, and skin or self-care. So let's go through each of those. Manual lymphatic drainage, or MLD, is a specialized hands-on technique that assists with moving the lymphatic fluid out and away from that affected part of the body, or in this case, the genital and pelvic area. This type of lymphatic massage is not a deep tissue massage that you would typically get if you're trying to get those muscles worked out with a massage therapist. MLD uses a lighter touch, and it should not feel like a typical massage with really deep pressure getting into those muscles. Your lymphedema therapist will teach you how to perform MLD, and they may even recommend using an intermittent pneumatic compression device. This is also known as a pump. Pumps can be really helpful to do the massage for you if you have a hard time doing the massage yourself, or if you have really severe lymphedema, to help with getting that fluid and that fibrosis better. But for genital lymphedema, the most effective way to treat it with hands-on techniques is going to be that manual lymphatic drainage. Stay tuned for my upcoming video on how to do manual lymphatic drainage for the genitals that you can do yourself. So next up with complete decongestive therapy is compression. This involves compression bandaging and compression garments. Compression bandaging can be tricky to do for the genitals compared to wrapping the arm or the leg, just because of the anatomy of the genitals. Compression wrapping is more often used for people who have scrotal or penile swelling, because it can be a lot more challenging and uncomfortable to do compression wrapping for the vulva. Compression bandaging uses layers of materials including stockinette, short and medium stretch bandages, foam, and even something called Coban to help with reducing the swelling. What's important to note is that ACE wraps and elastic wraps should not be used. These act differently than the bandages used for treating lymphedema, and they can cause more damage because they have so much elasticity. It's important that you work with a trained lymphedema therapist for the compression wrapping and not try to do things on your own without their instructions first. It often takes at least a couple weeks of performing compression wrapping to reduce that swelling and any fibrosis that you might have. Once those genitals are at their smallest size with the swelling reduced, the fibrosis reduced, then you can transition to compression garments. Either your therapist or a garment fitter will measure you to determine the type and size of compression garment that will be best for you. There are some great options available for compression garments and foam for the genitals to help maintain that fluid reduction. And one of the most common recommendations that I give are bike shorts. You want to make sure that they have a high waist and longer legs, not super short. And that's going to make sure that you're covering that entire area that you have the swelling. If you need something that's more cost effective, then you can get a pair of bike shorts at your local store like Walmart, Target, or a sports store. But the compression shorts that I really recommend the most for the best treatment of genital lymphedema are these Juzo compression bike shorts and Solita active massage compression shorts, since they're made specifically for treating lymphedema. You can get these at Bright Life Direct, and I have a link to them in the description below, along with a discount code that you can use with your purchase. Besides using compression or bike shorts, it's also important to have products that are going to provide direct compression to those genital areas that have that swelling. These products have foam in them, and they're going to help, again, further reduce swelling and any fibrosis that you have, because it's going directly against those tissues. This one in particular is going to be used for the scrotum. You can see that there's kind of a cup here that helps to support the scrotum a little bit more. And this upper pad part is going to be up on the lower part of the abdomen, and you can see it provides a lot of compression and a lot of coverage to help with reducing that swelling and that fibrosis. The one for the labia is similar, but there's not going to be as much of a cup and an indentation here. If you want something that's a little bit lower profile, these are really great. These are soft compress. They still have foam in them, but it's not as bulky. This one you can use for the scrotum and for the penis. Again, you can see that it has a little bit of a cup here that's going to help support. And you can also use this one to help with any labial swelling. This is going to be at the pubic area. This is going to be kind of up against the vulvar area that you can use to help with, again, giving that direct compression. One other one that I really like for the vulva is called a sweet spot. There's a couple different sizes of ones that you can get like this. This one is a little bit lower profile, which I like. They also have kind of a tacky back so that when you put them on your underwear, they stay in place pretty good. But again, this foam is going to be directly against the tissues. You can also put another underwear on top or a liner on top just to keep this clean. You can get these products at Bright Life Direct, and I have links in the description below to get these as well as a discount code. To help keep those swell spots and foam padding in place, you can use those biker compression shorts to help make sure that they stay in the place that you need them to. And since they're a little bulky, most people will wear these when they're at home and at nighttime. All right, exercise is the third component to complete decongestive therapy. Staying active and moving your joints and muscles helps to move that lymph fluid out of that affected body part in the genital area. Activities like swimming, walking, biking, and elliptical are great options to help with getting that fluid moving. And since the swelling is actually in the pelvis, doing pelvic floor exercises or Kegels can also help with reducing that swelling and getting movement of that fluid out of the pelvic area. Additionally, wearing compression bandages or compression garments while exercising can help further reduce that lymphatic fluid and decrease the risk of worsening of that swelling. Stay tuned for next week's video where I guide you through specific exercises to decrease that genital lymphedema. The last part of CDT is skin and self-care. These are just everyday things that you can do to reduce the risk of worsening your lymphedema. These include keeping the skin dry and moisturized with plain lotions or creams without any fragrance, using sunscreen and insect repellent, maintaining an optimal weight, and if any scratches or openings of the skin do occur in the area that you have lymphedema, wash it with soap and water, and monitor for signs of infection. If you have genital lymphedema, there is a much higher risk for recurrent infections in this area. Signs of infection can include redness, increased swelling, pain, fever, and flu-like symptoms. If you remove hair in the pubic area, using electric razors can help decrease the risk of cuts in the skin. And always make sure that you're using clean, new, sharp razors. So now that we've gone through what's included in complete decongestive therapy for genital lymphedema, let's talk about how they're actually implemented. Phase 1 is the intensive and reductive part. This phase focuses on reducing that extra lymphatic fluid from the genitals, moving it back into the circulation. In this phase, most people with lymphedema typically see their therapist several times per week. That's going to include compression bandaging, manual lymphatic drainage, exercise, and checking the tissue health. This initial phase 1 can last anywhere from 2 to 8 or more weeks, depending how long it takes to bring down the swelling and improve other symptoms, and if you're following your therapist's instructions for your home program. Phase 2 is the maintenance phase. This phase focuses on maintaining the results from phase 1 on your own. It includes continuing MLD on your own or using a pump, wearing compression garments and those foam garments, exercising, and making sure that you take care of your skin. Lymphedema treatment can be overwhelming at first, but finding a qualified, certified lymphedema therapist is the best first step on your journey. I'm including several links to trusted organizations below in the description so you can find a certified lymphedema therapist near you and get the treatment that you deserve. Please like this video if you have a better understanding of what genital lymphedema is and how it's best treated. Make sure that you subscribe to my channel, turn on those notifications so you don't miss any new videos on lymphedema, especially the next 2 weeks, which will include videos on exercise and manual lymphatic drainage for genital lymphedema.